The effort to get more people vaccinated are expanding, and there's new information every day. Today, the Biden administration announced those 1 million doses that would be shipped to pharmacies starting next Monday. Dr. Kavita Patel, NBC News medical contributor, joins us to talk more about where everything stands now. Let's start with the importance of that public-private partnership. Do you feel like this will be a big momentum changer?
Hi there, Cheryl. I do. Maybe not in the beginning because it's not that many doses and it's to about 6,500 pharmacies around the country. But remember, most of us have a lot more experience going to pharmacies or to clinic offices to get our vaccinations. So I do think over the next several weeks, this could be a game changer. And honestly, it could open up much more direct access instead of some of the frustrations around telephone lines or portals that people are having a hard time navigating.
Yeah, we've had a lot of websites crashing because of the demand being so high. Dr. Patel, there are healthcare providers who've held on to vaccine doses to ensure there'd be a supply when people come back to get that second shot. Do you feel it's necessary, or is it unnecessary and slowing down the efforts to really reach as many people as possible?
Yeah, it's a tough balance because we've been trying to hold these second doses to keep in with guidance for the timing of those second doses. But the Biden administration has also announced that they're going to give states and cities about a 21-day rolling basis of what our supply will be. So I do think now we should release those second doses to get as many people first doses as possible. We know that there's some immunity that starts after the first dose. And if we know that we're going to get a certain amount of supply in the future, Cheryl, we don't have to hold on because we'll still have enough to give people that second dose. And I think that this could open up just the chance to fight these variants that are in our country by getting as many people vaccinated as possible.
Before the virus continues to mutate. Curious about your perspective on two recent studies that suggest that those who've recovered from COVID-19 may only need that first shot of the vaccine to really sufficiently boost their antibody levels. What do you think about this? What's the evidence saying about it?
You know, it makes clinical sense because we know that when you get the COVID-19 infection, you do develop immunity and it lasts for months. So if you think about someone who's infected and has recovered, and then they get the first dose of their vaccine, that in essence almost acts like that second shot, giving them enough of that antibody response. So it makes clinical sense. We do need to see more data. And of course, the clinical trials that were done on these two vaccines available did not include people who had previously had a COVID infection. So I think it's promising. And again, I think the goal is to free up as many doses to get into people's arms as possible. And this could be one of those routes that we take should we see more of the data that supports it.
All right, Dr. Patel, really appreciate your perspective and insight. Thanks for the time.